Hey, hey, check, check, 1, 2. Hey, hey. Audio check. Hey, hey, check, 1, 2. Hey, hey, check, check. Hey, hey, mic check, 1, 2. You're welcome.
Good morning, everyone, and welcome. We have some extra seats up at the front here if anyone would like to join. Okay, we're going to get started here this morning. Good morning, everyone, and welcome. My name is Joey Deason, and I'm the Director of Digital Health Projects with the Virtual Health Hub. I'm honored to be your MC for today's event here at the Virtual Health Hub's office in downtown Saskatoon. Thank you all for being here and for sharing in what promises to be a meaningful and memorable occasion. Before we begin, I'd like to take a moment to acknowledge that we are gathered on Treaty 6 territory, the homeland of the Métis, We are grateful to live, work, and innovate on this land. We honor the contributions of First Nations and Métis communities whose leadership, knowledge, and partnership are foundational to the work we do at the Hub. I'd also like to acknowledge our northern partners up on Treaty 10 territory who have been dealing with the wildfires and ensure that they're in our thoughts. We're joined this morning by a number of special guests, partners, and leaders who share in our vision for better health access for all, and today marks a significant step forward in that shared journey. To officially open the program, it's my great pleasure to welcome a distinguished guest and longtime champion for Northern and Indigenous communities. We're honored to have him here with us today to share an important announcement that speaks to where the Virtual Health Hub is headed and how that direction connects to a broader national vision. Please join me in welcoming the Member of Parliament and Secretary of State for Rural Development, the Honorable Buckley Belanger.
Thank you so very much, and good morning to you all, and thanks for joining us for this very important announcement this morning. First of all, I just want to explain quickly the manner in which we operate as one of the few Liberal MPs from Saskatchewan. I'm the chair of the Liberal Caucus. I'm also the vice chair, and I'm in charge of all the parliamentary affairs for the Saskatchewan Liberal Caucus, because I'm the only one. But anyway, I would point out that the way in which we operate, as an MP, first of all and foremost, we represent the northern riding of the Snatimmisineepee-Churchill River. That's the folks that got me to where I'm at. The second perspective is really representing Saskatchewan at the national basis, and that in itself is a very daunting job, because Saskatchewan has so much to offer. And of course, the third component is being Secretary of State for Rural Development, which is, of course, right across the country. So there are a lot of challenges in travel and certainly challenges overall. I'd emphasize that again in the sense of trying to make time for all three sectors. But there is time in our busy lives to take the opportunity to celebrate certain things. So that's what I'm hoping to do today, and to again thank you all for being here, and to recognize Minister Cockerill, who I thought was a university student placed at work here, but anyway, that's a different story. I just want to thank Joey for his kind introduction. Again, good morning, everyone. It is a privilege to be here today in Saskatoon on behalf of the Government of Canada to celebrate a significant step forward for healthcare and Canadian innovation right here in my home province of Saskatchewan. Thank you to those that are here today to celebrate this advancement. And of course, with us today is my good friend, Chief Darcy Bear from Whitecap, Dakota First Nations, Dr. Ivor Mendez from the Virtual Health Hub, Caitlin Rogers from Can Health, Dr. Mike Wazalowski from Lexonic, Dr. Luke Napier from Virtual Hallway, and of course, Joey Deason also from Can Health. As Secretary of State for Rural Development, I have the privilege of traveling across Canada, as I indicated earlier, meeting with communities, innovators, and leaders who are building Canada. From the coastal towns in Atlantic Canada to Indigenous communities in the north to growing tech hubs in Western Canada, I have the privilege to see firsthand how Canadian innovation is driving economic growth and better outcomes for people. Our new government is committed to helping small and medium-sized businesses bring their innovations and initiative to markets across the country and, of course, around the world. Today, we are announcing that Virtual Health Hub is joining Can Health Network in launching new commercialization projects with two leading Canadian technology companies, Lexonic and Virtual Hallway. With Lexonic in Saskatchewan, we are seeing a virtual reality diagnostic imaging solution to northern Saskatchewan, so patients can receive faster, more accurate results without lengthy delays or transport transfers, and so on. With Virtual Hallway in Nova Scotia, we are enabling family doctors in remote areas to speak directly with specialists, so patients can get the care they need quickly and without unnecessary and demanding travel or referrals. These initiatives are investments in Canadian innovation, Canadian jobs, and more importantly, Canadian solutions. I am very, very proud of that. But as I mentioned, this is far more than just healthcare. It's all about our government's investment into building one Canadian economy, an economy that grows jobs, strengthens Canadian companies, advances reconciliation, and ushers a renaissance within our First Nations and Métis communities. As well, keep our innovations here at home so we can improve care for our people, the Saskatchewan people in this instance. Just recently in Hamilton, Ontario, the Prime Minister reminded Canadians all that, quote, Canada can be its own best customer, end quote. After having invested $42 million, we want to prove that statement true. This $42 million in investment into Can Health since 2019, we are certainly thrilled to see them showcase how Canadian technologies developed by Canadian companies are solving some of our biggest healthcare challenges. The Virtual Health Hub located on the Whitecap Dakota First Nations is building a state-of-the-art virtual care center that will bring high-quality, AI-driven health services to rural, northern, and the Indigenous communities as well. As Secretary for Rural Development, ultimately this is all about making sure that geography is never a barrier to care, and ensuring that all people, and that includes Indigenous leadership and Canadian innovation, work hand in hand to close those critical gaps within our healthcare system. On behalf of the Government of Canada, I want to thank all of our partners for making this possible. The Whitecap Dakota First Nations, Chief, I thank you. The Virtual Health Hub and its leadership under Dr. Ivor Mendez, Doctor, thank you again. The Can Health Network, thanks. Lexonic, thank you. The Virtual Hallway, thank you. And of course, all the clinicians and the communities moving these projects forward. No question that this is a proud day for Saskatchewan. Our friends in Nova Scotia, and if there's anybody from Nova Scotia here, I love that province. It's just absolutely beautiful. So if you have a chance to visit, visit. I was there several weeks ago and very impressed. Nothing like home, but man, it's a beautiful part of our country. So I would say this is a proud day for Saskatchewan, our friends in Nova Scotia, and of course, for Canada. Together, we are proving that made in Saskatchewan, made in Canada innovation can transform care while creating prosperity for all Canadians. Thank you so much, and I'll have my friend Chief Darcy Bear come forward. Thank you.
Thanks so much, Mr. Belanger. I'd like to give a quick acknowledgement of a key provincial leader whose support has been critical to the success and momentum of the Virtual Health Hub. We have the Honourable Jeremy Cockrell, Minister of Health for the province of Saskatchewan, who's been a strong advocate for healthcare innovation and improving access to care for all corners of our province. The Government of Saskatchewan has shown meaningful support for the Virtual Health Hub from the very beginning, including an investment into our new Virtual Health Hub building that will be starting construction soon. Thanks so much for being with us this morning, Minister. It's now my honor to introduce Chief Darcy Bear, a leader whose stewardship of Whitecap Dakota Nation has not only led to remarkable progress and prosperity for his community, but whose unwavering support and forward-thinking leadership has allowed the Hub to find its home right on Dakota territory. Chief Bear's success in building sustainable, self-determined models of governance, economic development, and health innovation has served as a model for transformation across the country. Please join me in welcoming Chief Darcy Bear.
Pidamaya Joey, thank you. Humitaki api patigda washdedo, chete washde wasna the petchusapi, wakamani himaki apia. Virtual Health Hub at Diana Heatby. First of all, I want to, of course, thank Joey for the introduction. I want to, of course, recognize a good friend of mine, Buckley Belanger, the Secretary of State. Known Buckley for many, many years. I've served in my nation for 33 plus years now, 30 plus years as a chief, and I knew Buckley when he was a minister with the provincial government back in the day. So it's been a journey for both of us. Our daughters are actually good friends, and my daughter called me this morning. She says, make sure you take a picture with Buckley because you guys spend more time together than Taylor and I do. so we're going to get a picture later. Yeah. Also want to, of course, recognize Minister Cockrell and thank certainly Premier Moe and the provincial government for all your support. It started with our Chief of Operations today, who is Paul Merriman, former health minister, and we started this journey together. Then, of course, went to Minister Henley, now Minister Cockrell. But again, unwavering support from the province, looking at providing care for all of our citizens across Saskatchewan. Of course, I also want to recognize Dr. Mendez. Whitecap had actually signed a memorandum of understanding with the University of Saskatchewan, looking at building an international Indigenous health research center. But out of all the people that were in that room, the only person I seen that was actually doing things was Dr. Mendez. And so I said I got to meet this guy. I told that to Riel Bellegarde, the chair, the president and CEO of the Saskatchewan Indian Institute of Technologies. So we met in 2017. And it has been a journey, but we finally got everybody on board, thanking the province, the federal government, of course, the $50 million capital contribution to the virtual health hub, and the $30 million capital contribution from the federal government. And now we're going to be under construction here shortly. They're supposed to be on site today. PCL got the contract, and it's supposed to be a 568-day build. We're opening in February of 2027. So I'm going to hold them to that. But in the meantime, this is our headquarters here in downtown Saskatoon. I want to also recognize from Luxonic Dr. Mike Wazalowski. We're talking about Screech this morning, and I'll start it with, of course, with Virtual Hallway Dr. Luke Napier. And he was saying he was from Halifax, and I talked to him about when we were playing ball in Nationals in Niagara Falls. We met a group of a ball team from Newfoundland, and it started raining, and they took their shirts off, and they started drinking the Screech, and they're dancing in the rain. So we had the Screech discussion this morning. So I also want, of course, from Can Health, Kaylin Rogers, again, thank you for the partnership and connecting the Virtual Health Hub with Canadian companies such as Luxonic and the Virtual Hallway. And they will talk more about themselves shortly. But again, I need to remind the public that this is public health care. Some people say, oh, it's private health care. The virtual health care is private health care. It is not. It is absolutely not public health care. It's absolutely not private health care. It is public health care. And it's something that we pride ourselves in, again, with our partnership with the province and the federal government. And some of the amazing work that's been happening. I know when we were talking about with the former Prime Minister Trudeau about, say, for example, there is a high infant mortality rate in northern Saskatchewan, because in order for a woman to get an ultrasound, it's a 3-day process. They got to fly them out of the north. They go to Prince Albert or Saskatoon. It's a 3-day process. They can't bring their spouse with them. They have to travel alone, and it's a simple procedure. So now with the robotics and artificial intelligence, we can now have robotic arms in the north. The staff there get trained how to utilize that. The ultrasonographer is actually right here in this building here, and they can actually do the ultrasound in real time And so we just deployed one just recently in Stanley Mission with Chief Tammy Cook Searson's nation, Lac La Ronge Indian Band. And Chief Tammy Cook's also on our board as well. And so now and there was a team that came from Paris, France to deploy that technology. And now it's actually operational in Stanley Mission. So those are the good things that the Virtual Health Hub is doing for public health care, and it's going to continue. And we've got interest right across Canada. Every province is now interested in the work that we're doing here in the Virtual Health Hub. So Saskatchewan is going to be that leader. And we also got international interest as well. Dr. Mendez, we talk about Barcelona, Spain, and Norway, and they've invited us out there. But Dr. Mendez claims I have to eat eel when I go to Barcelona. I don't know. I don't know if I want to eat eel, but so again, it's just it's been a great journey, and I want to thank all of our partners and everybody working together to provide more efficient, effective public health care to all Canadians. Homitakiwas Piramea.
Thanks so much for that, Chief Bear. It's now my privilege to introduce a leader whose vision is not only the foundation of the Virtual Health Hub, but the force that has brought it to life. Dr. Ivar Mendez. He's a nationally recognized innovator and trailblazer in the fields of neurosurgery and virtual care. But beyond his credentials, what sets Dr. Mendez apart is his relentless drive to transform healthcare, to ensure that geography, infrastructure, or access never stand in the way of patients receiving the care that they need. It's really impossible to exaggerate the impact that Dr. Mendez has had on the Virtual Health Hub. The hub is really a manifestation of his vision and his belief that innovation and Indigenous leadership can reshape the health system. His dedication, persistence, and ability to unite partners across sectors has really made this vision a reality, and the impact is just beginning. Please join me in welcoming Dr. Ivar Mendez.
Thank you, Joey, for those generous words, and thank all of you for attending this announcement. The Virtual Health Hub came and was born from the concept that every Canadian deserves access to healthcare, regardless of their geographical location. And from the moral imperative that we should focus on the communities that are really underserved, the marginalized communities across our country. And many of these communities in the north are Indigenous communities. So the focus of the Virtual Health Hub is in Indigenous communities, remote communities, and rural communities. This is truly an Indigenous-led project, and thank you, Chief Bear, for your leadership over the years. Thank you, Chief Tammy Cook Searson from the La Ronge Indian Band, and Buckley Belanger, who is the president of SIIT. And what we're trying to do is to use technology to be able to narrow this gap of inequity in healthcare delivery. The Virtual Health Hub is building this unique state-of-the-art facility in Indigenous land in the Whitecap Dakota Nation. This facility, the first of its kind in Canada, will use truly advanced technologies, including robotic systems, advanced virtual care systems, AI systems. And you see a lot of these technologies in this room. And we truly believe that a Canadian technology should be at the forefront of innovation in the world. And this is why it's so fundamental and important to have this partnership with CanHealth, who is an entity that really brings the partnership of Canadian innovators and companies to partner with healthcare delivery institutions to use Canadian technology to provide healthcare. And of course, Mike and Luke will talk about their companies. We truly believe that Canadian innovation and technology should be deployed not only, of course, in Saskatchewan, the rest of Canada, but globally. And we feel that working with companies like that, we will be able to advance the knowledge. And as Secretary of State Belanger has indicated, and again, thank you, Secretary of State, for all your great support, that these companies are an engine of the economy. Not only are able to provide the healthcare and allow us physicians to use those tools to provide healthcare and reach these populations, but they really influence the economy, influence the capacity of us to attract talent. People at the top of their game come to institutions where they can fulfill their full potential. And we hope that the Virtual Health Hub can be part of that. And I also want to thank Minister Cockrell for his personal support and the support of the government of Saskatchewan to make the virtual healthcare a reality in Saskatchewan. You know, I'm not exaggerating when I say that all of the jurisdictions of Canada want to see this as a model of healthcare in the future. And Minister Cockrell, Saskatchewan is leading the way on this, not only at the national level, but internationally. And we're proud of our team and on what we're doing. So we feel that we are building this roadmap on the future of healthcare delivery. As you know, technology is changing tremendously. We cannot be doing what we've been doing over the past 3 decades. And our healthcare system really is facing tremendous challenges of overcapacity in our tertiary care centers, in our emergency rooms. We need to train and to utilize the technologies of the future to be able to face those challenges. But something that we've learned over the years of working with our Indigenous communities is that this is not only about technology. It is about building these trusted relationships with those communities and designing the solutions that will be deployed in these communities with them, respecting their principles, culturally appropriate, respecting the issues of data sovereignty. So we are building these roadmaps that not only will be applied to Saskatchewan, but could actually be scaled up nationally and globally. And this is really the role of the Virtual Health Hub. Finally, I just want to thank our team. We have this amazing dream team, a multidisciplinary team of clinicians, computer programmers, engineers, population specialists, researchers, robotic technologies. This is a unique team that you cannot find anywhere else, all working together in looking at the future and how the Virtual Health Hub will influence that. So thank you again, everybody, and thank you all our partners for all the support. You know, when I came to Saskatchewan 11 years ago, they told me the sky in Saskatchewan is really big. And it's truly big, especially in a beautiful summer day like this. But that reminds me that truly the sky is the limit. I'm truly optimistic that we will be able to use technology to provide better health care to our population. And that is what keeps me coming every morning to work with the Virtual Health Hub and advanced healthcare. Thank you very much.
Thank you, Dr. Mendez. Now let's turn our attention to the companies at the heart of the 2 projects being launched as part of this new exciting chapter. First, from Luxonic Technologies, we're pleased to welcome Dr. Mike Wesolowski, CEO. Luxonic is advancing virtual reality solutions for diagnostic imaging, enabling remote radiology in ways that were once unimaginable. Luxonic's digital platform will fuel the inner workings of the Virtual Health Hub's remote diagnostic imaging department, supporting clinical workflows and enabling access to advanced imaging studies for Saskatchewan's most remote populations. Please welcome Dr. Mike Weslowski.
Good morning, everyone. It's an honor to be here today with Secretary Belanger, Chief Bear, Dr. Mendez, and the entire Virtual Health Hub team, as well as our partners at Can Health. As a proud Saskatchewan company, Luxonic is especially meaningful for me and for Luxonic to be part of an initiative that's improving care for communities across our province and across Canada. At Luxonic, our mission is simple: ensure every Canadian, no matter where they live, can access world-class diagnostic expertise when they need it most. Our patented virtual imaging platform, which you see in the video here, is a full stack radiology workflow application built right here in Saskatchewan in virtual reality and powered by artificial intelligence. It lets radiologists securely review and interpret diagnostic images from anywhere, supporting faster diagnosis for patients, including those in remote communities in northern Saskatchewan, as well as the rest of Canada, where access to imaging specialists has long been a barrier. Through the Virtual Health Hub, our technology will power a mobile imaging pod that rotates through northern communities. Local clinical assistants will work on site with virtual technologists and radiologists, and they will connect in real time using our platform, ensuring that patients get the same standard of care that they would in Saskatchewan or Regina without having to leave their community. So a patient in Stanley Mission can stay in Stanley Mission to receive the best health care possible. But getting to this point has not been easy. Canadian companies often face steep hurdles when it comes to growing at home. Breaking into our own healthcare system can be one of our toughest challenges, and scaling against large international competitors often feels like an uphill battle. That's why partnerships like this and organizations like Can Health are game changers for us. This is actually our second project with Can Health. These projects give companies like ours the opportunity to prove our technology in real-world settings, build trust with healthcare providers, and accelerate adoption across Canada. Without this support, many Canadian innovations risk never getting off the ground in their own backyard. With the backing of the Government of Canada, the leadership of the Virtual Health Hub and Chief Bear, as well as Can Health, we're seeing real momentum start to happen. It's helping us grow as a company and deliver better care to rural and Indigenous communities. At Luxonic, we're proud to be building the future of healthcare right here at home. Together, we're proving that Canadian-made solutions can lead globally, and we can transform how healthcare is delivered to every patient across the country. Thank you.
Thank you for that, Mike. Next, we welcome Dr. Luke Napier, co-founder and chief medical officer for Virtual Hallway. Their innovative platform connects rural providers to specialists, streamlining consults and improving care access in communities all throughout Saskatchewan. The ability to connect primary care clinicians to experts in various fields of medicine not only augments clinical teams, but significantly enhances the access to specialist care for patients. Please join me in welcoming Dr. Luke Napier.
Yeah, good morning, everyone. Thanks for being here, and thanks for having me here. My name's Dr. Luke Napier. I'm a psychiatrist and a co-founder of Virtual Hallway, and I'm honored to speak with you today as we officially launch our collaboration with the Virtual Health Hub and Can Health here in Saskatchewan. This is a province with incredible communities and incredible distances. Nearly 1 in 5 people live in rural or remote areas, but most specialists are concentrated in our cities. That imbalance creates real pressure on patients, on families, and on the primary care providers doing everything they can to support them. Too often, those providers are left without timely input from a specialist, and patients face long delays or long travel or both. Virtual Hallway was built to change that. We're a platform that allows clinicians, so that's family doctors, nurse practitioners, and specialists, to connect quickly by phone. It's scheduled, it's documented, it's reimbursed, and it works. Over 8,000 clinicians across Canada now use Virtual Hallway to solve clinical questions faster, to avoid unnecessary referrals, and to get patients the care they need without delay or disruption. In Nova Scotia, 84% of Virtual Hallway consults avoid the need for an in-person referral. In PEI, they conducted the same research and found it to be 87%. PEI's health minister calls it transformative. And in province after province, clinicians tell us the same thing. This changes how care is delivered. Today marks the start of that same journey here in Saskatchewan. Beginning this fall, Virtual Hallway will be connecting rural primary care providers with urban specialists. So that means that a family doctor in La Ronge can speak to a psychiatrist in Saskatoon to get a care plan for their patient that otherwise would have required significant travel and taken months. Our goals are simple and measurable: reduce unnecessary referrals and transfers, increase confidence in rural clinical decision-making, and support the providers who are already doing so much. This project is a collaboration in the truest sense with the Virtual Health Hub, Can Health, local clinical champions, and the communities we serve. Together, we believe we can bring equity to access. Together, we can make it easier for remote clinicians to get the insights they need when they need them. Thank you for your support, and thank you for believing, as we do, that where you live should never determine the care you get. Thank you very much.
Thank you, Dr. Napier. We're now pleased to welcome Kaylin Rogers from the Can Health Network. Kaylin, it's been such a pleasure working with you so far. Kaylin's going to speak of the importance of Saskatchewan's role in this national network, the impact Can Health has made across the country, and why Virtual Health Hub represents a major opportunity to transform rural and remote care, starting right here in Saskatchewan. We're so grateful to have her here with us this morning in Saskatchewan. Please join me in welcoming Kaylin Rogers.
Hi, everyone. Thank you so much for having us here today. I promise I'm not actually saying this much. Can Health Network was founded on a really simple idea, and that was that Canadian innovators and entrepreneurs should be able to succeed here at home. Secretary Belanger, you said it so well. Canada needs to be its own best customer. We spend so much money in the delivery of healthcare, and we have incredible Canadian ingenuity here. Whether it's physicians like Luke that you just met, we have the solutions here at home, but what they need is the chance. What Can Health Network does is it takes healthcare operators and it matches them with Canadian companies. It allows them the opportunity to work directly together in the hopes that we can then scale them across Canada. What's unique today is we are announcing an official partnership with Virtual Health Hub, which is unlike anything we've really seen in Canada. Today's partnership is not just about the opportunity for Canadian companies to work with this incredible institution, but it's actually a new model of care. We believe at Can Health, the work that's happening here is something that could be applied in Nunavut, in Northern Ontario. You're so fortunate here in Saskatchewan to have the leadership that you do. It's rare that you get a room together of you have federal leadership, provincial leadership, your Indigenous leadership, and your healthcare leadership, and entrepreneurs. It's just unheard of. And so we are so pleased today to be part of this partnership. I want to talk a little bit about why the focus on Canadian companies. Mike has an incredible career, has spent countless hours trying to build a company. He could have probably gone to the US many years ago, but he chose to stay here in Saskatchewan, where he employs over 10 people. These are 10 great jobs here in Saskatchewan. He made that sacrifice so that we can have better care here. Same with Luke, physician, frontline, saw a problem. He could have just said, oh, this is the healthcare system, it's broken. But instead, him and a team of physicians out in Nova Scotia said, this actually isn't good enough. This isn't good enough for our patients, and we could make a difference. And so on that notion, they founded Virtual Hallway, which we've been working with in Nova Scotia, and just seen incredible results. And I think the opportunity for both your companies, not just here in Canada, but the world needs more Canada. And when I think of what that means, I think of these two great Canadian entrepreneurs. What we've seen in Can Health, so we just celebrated 6 years, thanks to federal investment in 2019 and again in 2022, we've been able to do the work that we do. That means 127 commercialization projects. Today makes it 129. Maybe before we leave here, we can make it an even number and get a third, Dr. Mendez and Joey. I'm sure you have some ideas. The results of that has meant we've worked with 100 unique Canadian companies. 2,300 jobs have been created following working with the Can Health Network and our Canadian health operators. And that represents close to $700 million in revenue back in the Canadian system. And I think that's something important that Dr. Mendez said that I want to pick up on. The entrepreneurs and the people who run businesses are what allow us to create Virtual Health Hub and these publicly funded healthcare operators that we so need. We're really proud of the work that we're doing and believe it's only just the beginning. And what we know to be true is if you give the Canadian entrepreneur a chance, they will not just succeed, they will exceed our expectations, they will beat out their international counterparts, and all of us will have better care. So thank you guys so much. What an honor to be here today with all of you.
Thank you, Kaylin. And thank you once again to all of our speakers and to each of you for being here today. As we bring today's program to a close, I want to leave you with a final thought. What we're celebrating here today is more than a partnership or more than just a technology launch. This morning represents a shared commitment between communities, governments, and innovators and care providers to reimagine how healthcare reaches people no matter where they live. The Can Health Network isn't merely supporting a project here, it's enabling a movement, one that positions Saskatchewan and the Virtual Health Hub as a national leader in rural and remote care. Together, we have the chance to prove that care can be equitable, technology can be human-centric, service delivery can be decoupled from geography, and Indigenous-led innovation can drive system change across this province and country. On behalf of the entire Virtual Health Hub team, thank you for your belief in this vision and for walking alongside us as we build what's next. After the event, please join us for a group photo, and then our speakers will also be available for one-on-one media interviews. I'd like to thank all of the dynamic teams that were involved, the dynamic communications teams, logistical teams from all the organizations involved, as well as the media teams for being here with us this morning. And especially thank you, all of you, for being with us. That concludes the event, and have a great rest of your morning.
We can stand whatever you guys want. Can you bring Minister Coker? Yeah. Should we just? You want to move this? Or?
I hope she's not the toughest one
Oh,
today.
you know me.
I don't know who's going to be first, but do you want to just okay? So go ahead. I'm not sure who wants the first question. But
Secretary Belanger, I actually have questions from our national team.
yeah.
So multiple premiers, including Ontario's Doug Ford, have called on your government to swiftly retaliate against the U.S. because of the tariffs. Should we expect that your government will increase levies on the Americans now that the August 1st deadline has passed?
Well, what I'll point out is that our Prime Minister has been working very diligently on this particular file. He's fully aware of some of the challenges as it relates to our relationship with the U.S. And, he's very, very capable and is spending a lot of time on this particular matter. So I'll leave it in his very, again, capable hands to move forward on those discussions.
And just a quick follow-up, Mexico received a 90-day pause on tariffs, and President Trump also cut deals with the UK, EU, Japan, and others. Why has it been so difficult for Canada to negotiate with the Trump administration?
Again, our Prime Minister has had extensive experience on this particular file. He's leading with some, I have great trust and faith in our Prime Minister, and I have a lot of trust and faith in the ministers that are assisting the Prime Minister, so we'll let them do their work and continue negotiating on our behalf.
So this is an exciting announcement, especially considering the hard year the North in Saskatchewan's been having.
Yes.
How does it kind of tie into, this need for health care, especially in the wake of all the wildfires that have been happening?
Well, obviously, you mentioned wildfires. I'm trying to get home. I've been trying to get home for the last several days. There's, access to my community is very limited. We've been in and out of the smoke-filled north over the last several weeks, so of course our prayers and thoughts are all with all the families that are struggling. There's some communities are being repatriated, and they're very happy with that. Beauval being one of the examples, but others are now being evacuated. So it's just a non-stop issue for them. But clearly, I think, the level of cooperation between the federal and provincial government has been very good the last number of months. We thank all the workers that are doing their very best to contain these fires. But certainly, it is an ongoing challenge, and many lessons could be learned from this. And this is exactly what we see now with the opportunity around healthcare. That it doesn't matter where you live in Saskatchewan, especially in northern Saskatchewan, which is my home. There'll be opportunities now for the medical professionals, doctors, nurses, lab techs, and so on and so forth, to be able to help with prognoses and to help address some of the healthcare from even the remote areas of our province. So it's always good to see that happen.
Absolutely. And so have you seen examples of where this type of model will fit where you're from?
Well, that's the innovative part. We have Canadian-based companies that are providing some of the technological opportunities. And don't forget that these are tools afforded to the public healthcare system, afforded to our doctors and nurses and the clinicians that are out there and the other professional teams that form the basis of our healthcare. So these are tools meant to assist them, and so they can make their prognosis and understand the patient's needs better, quicker. And then that's the whole effort here. Good?
Thanks, Secretary.
Thanks so much.
It's always good to see you.
Yeah, it is.
Congratulations.
Thank you.
again.
Yeah, it's great. Yeah.